I'd love for you to teach us about the mismanagement of women's health in the medical industry.
Oh, where to start there, right? Okay, so if we think about like how medicine evolved, it really evolved. I mean, even when you look back at like the great artists, the male body is the standard. The male body is the standard. If some would even say like the perfect specimen. And then we have the inferior model with baby making accessories, and that is the female body. Now, you talked about the pharmaceutical industry. So I presume that conversation surrounded the fact that it was like, we're going to test drugs on men. And then we're just going to say, like, women are too complicated to test the drugs on them, but they're not so complicated that we can't just like introduce those into the general population. Like, no big deal. No, we've come to find out it's a really big deal. We also know that things like heart attacks has always been set by the male standard, that, oh, men have chest pain. Therefore, if a woman isn't having chest pain, she can't be having a heart attack. Turns out we present completely differently when it comes to heart attacks, which is kind of funny because that just came out recently where they're like, hey, period pain's like as painful as a heart attack. And it's like, except women don't have pain, chest pain, like men do when they have heart attacks. But once again, you even took period pain and compared it to the male standard and said, oh, which is great for getting men to listen. I mean, they should just like listen without us having to say something like that. And yet
Right.
that's what's still going on. We also know that women's conditions overall are usually chalked up to hysteria. Everybody loves to be like, Hippocrates is the father of medicine. Like, he's so great. Okay, did some good stuff. Also, labeled women as hysterical, like the uterus wanders the body and goes to her brain and makes her crazy. And that persisted until the 1980s. Was still a diagnosis to just basically be like, oh, you don't got anything real going on. You're just hysterical. So we've got dismissal of women's pain. We've got lack of actually catching, serious conditions like heart attacks. We've got like dismissal of just about everything. It's pretty pervasive in medicine, right? And that even persists until today. So while hysteria may not be in the DSM-5, you may very well see a provider who was trained by a provider who very much subscribed to hysteria. So that's where we're at, is that bias and that influence is still being passed on. And it is going to take generations of doctors until we finally move away from this place where it's all in your head. Your labs are normal, so you should just feel normal. Like, why are you questioning me? I have a white coat, therefore you should just listen to everything I say like it's gospel and never once challenge me on anything. Like, that kind of dogmatic medicine has been harming women for our generations, right?